So, the last thing I want to talk about before I turn to questions and do a check on time is stories and learning from others. And on our website, we have this place you can see over in the corner called Connections, where you can find stories about other communities that are doing this. And you should really go there if you haven't gone there, because there's a story from a couple of years ago from Muskegon. And I was telling folks last night, I think after this visit, it'll be a great opportunity to update that story as well. But there's a story on there from Hernando, Mississippi. This is a video. It's about 5 to 7 minutes long. I'm not going to show it today, but I encourage you to go take a look. And in Hernando, Mississippi, which is it's in DeSoto County, Mississippi. It's the healthiest county in Mississippi. But Mississippi is about the 47th or 48th unhealthiest state. So they have, well, we all have health challenges that we can work on. At any rate, their community has really come together to focus on reduction of obesity in their community, which has led into other efforts. And so when their current mayor, Mayor Chip Johnson, was elected, they had closed their park department because of budget cuts. And Mayor Johnson, that's not how you build a healthy community. And so he's worked with local investors to really revitalize their parks. They've reopened their park department. He's worked with city employees on city wellness, which resulted in a significant cost savings on their health insurance, which he then turned around and gave their city employees a raise. So I think it's a great story about talking about in an employment setting, how if we can all work together to control the costs of our rising health insurance costs, what can be the benefit that comes back to employees as a result of that. They talk about work they're doing to make their community a more walkable and bikeable community. They talk about work around community gardens and farmers markets and making fruits and vegetables, you know, in a part of the country where you have it a lot more of the year than we do here, more accessible to people. The rest of the story that's not in the video that I just heard last week is Mayor Johnson called our colleagues at the Robert Wood Johnson Foundation to say that they had just finished completing a deal with a new manufacturer coming to their community that will now provide 60 to 70 new jobs in that community. The first new manufacturer to come to that community in decades. And so I think this is a sign that when you do this kind of work, when you show people from the outside that you are taking action to improve your community, when you make it very public, do not hide your light under the bushel basket. Really tell people about what you're doing and share this news. It will result in what we also know contributes to health, which is stronger economic development, jobs for your community and jobs for your citizens. So really important to have your elected officials here, have your chamber leaders here, have your business leaders here, because that really is how this all links together. So that is what I have to say today. Little promo. You can stay connected to us. We will fill up your Facebook feed all the time. But the nice thing about following us on Facebook or Twitter or signing up for our e-newsletter is you'll know about the upcoming webinars. You'll also know when there are new funding opportunities that come available through this project from the Robert Wood Johnson Foundation, that those are coming so you can apply. I know many of you may be aware that we are going to issue prizes to communities who are on the path to good health. Those prize applications were due a couple of weeks ago, and I know Muskegon is in the running, I mean, because you submitted an application. And so congratulations to you. And one of the reasons we have initiated this prize is we want to spread good news about what's happening. We want to help communities celebrate being on this path towards good health. And so I wish you the best of luck, and I can give you no further information. Even though people were bribing me with to take me to the bar because they know I'm from Wisconsin, so I'd probably binged. Anyway, congratulations for submitting an application. I have to say, one of the best parts of my job over the last couple of weeks is reading these applications because they're just great stories. So, and that is my contact information. Oh, one other key thing I forgot to say is we have expanded our staff. When we first started the county health rankings, I was it in terms of reaching out and assisting communities. But you'll find on our website throughout the Action Center, it says get help from the Rankings and Roadmaps team. And you can click on that and send us an email, or there's a phone number there and you can call us. I have several other colleagues who are providing consultation with communities. And so if you're stuck on something, if you want to talk about something, if you want to have us do a phone meeting with you with a group that's working, we are here to help support the work that you are doing moving forward. And so do not hesitate to be in contact with us. So let me stop there. Lynda, I don't know how we're doing for time, but
great.
okay. And I'm happy to answer any questions about rankings, roadmaps, what you're doing. I'm here for you. Questions? Yes.
I have a question about how the actual factors are weighted. Each of the individual factors are weighted. And actually, I'm a graduate of the University of Wisconsin Graduate School of Educational Policy Studies, and I see that education as such is not heavily ranked as a factor as one of the social determinants of health. And so if you look at how to move the needle, you have to look at the stuff that you're doing the poorest and weight it the heaviest.
Let me just...
I mean, it's great that we selected education, and we're the only ones who did, because it's really an important social determinant, but it isn't that heavily weighted in the rankings.
Well, it is in terms of the health factors. I mean, first of all, social and economic factors weights 40%, right? And you're right, those two measures of education rank 10%. So they, in terms of the total health factor rankings, the education measures are 10% of the total weight that contributes to the measure of the health factors. As I was telling folks last night, the broad categories, the 4 broad categories, there's more evidence about how those broad categories contribute to health. And in all reality, our weighting is our best guess, best educated guess. We don't know precisely how much each of those 4 broad categories are. So I think it gets a little leaner in terms of the evidence when we drill down within social and economic factors to look at the relative weight. You'll notice employment and income weight heavier than education. And I think that the evidence probably supports that fairly well. But the other thing, I guess the other point I want to make about your question is the model acts like these are all separate and distinct and there's no relationship between them. But we understand very clearly that the reality is they're really more like Venn diagrams where there's overlap between these different elements. And so, you know, the relationship between education and employment and income is very strong. So the work you're doing in education is actually work that will also contribute to income. And so if you think of it that way, you know, you've got 30% contribution there. So they are relative. The other thing is I want to be really clear about is these weightings are primarily mathematical calculations for us to know how to calculate the rankings. So in real life, they may be bigger or smaller. The other thing that's missing is certainly one of the things that determines health is genetics. And we don't rank on genetics because there's no population health measure of genetics, and there's really very few viable ways to change genetics that are ethical. I mean, there are ways, but so I would say don't be discouraged by looking at that and saying it's only 10%. I would say look at that and look at it as part of a weighting that is really salient in terms of the rankings and contributes to other things. The other thing is education affects many of the things in health behaviors too. And so we know when you increase educational levels, you see decreases in many risky and unhealthy behaviors as well. So it's really, I hear your point and I'll take it back, but it's it's a give and take about how we get to 100% on those. So, the gentleman in the orange shirt had a question too, and then I'll go over here.
Oh, so.
Or was it the same?
It was similar. But
Oh.
Tom was a superintendent for Oakers Public Schools, and we have one of the community health workers with Project Healthy Grad. A complementary thing that we're pursuing is through a Kellogg Foundation, trying to get a school-based, nurse-managed health center right in our school. I didn't see much in this as any guidance, and that's something that we should be pursuing. And I just would like some feedback. Are we heading in the right directions? Particularly when I look at the data from the hospital, that our zip code is the highest charity care in their hospital service provider areas, emergency room. Our kids just don't have access to care.
No, I think you're heading in the right direction. Again, I don't do the evidence analysis on what works. I look at it a lot, and I'm not sure if we have evidence ratings on school-based health centers or workplace health centers. I'll have to check on that. But I also think there are things, we've had a lot of talk about when things make common sense, sometimes they don't get studied. And so we know if you put healthcare closer to where people are, and there are fewer barriers to get to it, that people are more likely to utilize it. So I would say that rationale certainly supports health centers in your school, especially coupled with other changes in your school to make your school an environment that it's easier for children to make healthy choices, like physical activity support, like healthy nutrition, like ways to engage their parents also in both their educational and their health behaviors at home too. So I would say none of these interventions are single bullet solutions to health. They all are part of that environment you're creating. But you're definitely on the right path, and I will check and get back to folks about whether we have evidence or if we've looked for the evidence specifically about school-based health centers. I want to say yes, but I can't answer it off the top of my head.